What if we could end homelessness? What would it take? For the chronically homeless, they need more than a home and a job to pay for it. They need the health to believe in that dream and to sustain a new life. And they need to know where to find it. Our mission is to end homelessness. We've spent over 45 years finding creative solutions to make that a reality in New York City. One of these is bringing help to where the homeless are. Our mobile med vans bring doctors to New York City's most vulnerable, caring for those who have been homeless much of their lives, providing mammograms to the uninsured, HIV tests, and the primary care and psychiatric help that so many need. At our start in the 1960s, alcoholism, drug addiction, mental illness, they were all crimes, not diseases. Project Renewal came about as one of the first organizations trying to humanize the problem. We realized we had to come to them.
And how exciting it was, because it was groundbreaking. We were being creative. At the time, we would tool around town in a little VW van, 2 social workers and a driver. Quite the picture. The drop-in centers didn't have case management services. There were no psychiatric services for this population. That was one of the reasons that we developed the mobile psychiatric outreach team, which was meant specifically to serve the drop-in centers and the clients that were coming directly from the street.
Today, our unique program sends out 4 medical vans that go to every borough of New York City. Last year, we treated over 7,000 patients, but we could help more. According to the U.S. Census Bureau, almost 1.2 million people in New York City are uninsured. That is the size of Dallas, Texas. And the number of homeless New Yorkers living on the street, not in a shelter, increased over 20% last year, and shelters sleep more than 40,000 people a night. That's Shea Stadium at capacity, every night of the year. What can we do about it? Access to our medical vans is the first line of defense and can make all the difference.
My son was around 2.5 years old, and I had just stopped breastfeeding because it started to get a little painful. He got teeth, and I had a pain on my breast. And I didn't really pay attention to it, but I thank God that one day I just said, you know what, I better try to get this free mammogram, because I didn't have health insurance. And I'm glad that I did that, because if I hadn't done it, I would have never found out that the lump that I had was not a buildup of milk, but it was actually breast cancer.
What if everyone who needs our services could know about them? What if every shelter, every soup kitchen, every church with the homeless crowding their front steps knew where and when they could bring someone to a van on a street corner to receive help? And what if just one more woman like Merit Zella found out about the lump in her breast in time to get care? Who would you help? With a new mobile site, we could get the word out and be one step closer to ending homelessness. And that's how the Atlantic BT grant program will mobilize our mission.